Good morning and welcome to Lifespan's premier two-day event, Living Your Best Life, Aging Well with Resilience webinar. My name is Stephen Matsey, and I'm honored to serve as Lifespan's Program and Outreach Coordinator. We are truly grateful that you chose to spend your morning with us and hope that you will join us again tomorrow for day two. Thank you. During these unprecedented and challenging times, our community's older adult service providers continue to make every effort to reevaluate, reassess, and recreate their programs and services to ensure that our aging population does not become even more isolated and lonely than many of them already are. These are the alarming and troubling side effects of the COVID-19 pandemic. Our lineup over the next 2 days includes professionals from the aging field who are dedicated to the health and well-being of our senior communities. Today, we are pleased to welcome, in order of appearance, Bay Area geriatric physician, Dr. Elizabeth Landsberg, Aging Life Care Association CEO, Tawny Hamill, Lifespan's community liaison and champion for the Alzheimer's Association, Francie Newfield, and Lynn Knudsen with Sally Bookman of Next Stage Productions. It is our hope that you find value in the information they will be sharing. Whether you are a senior, a family member with older relatives, an aging and healthcare professional, or a care provider, together we can help everyone live their best life every day of their life. Before we get started, let's do a little housekeeping. All of your microphones are muted and videos are turned off. However, you will have the opportunity to ask questions using the Q&A function at the bottom of your Zoom screen during each of the presentations. We will answer as many questions as possible, but if we don't get to yours, rest assured we will follow up with a response as soon as possible. You are also free to come and go as you please. Just use your original Zoom link to come back to the webinar at any time. In addition, today's event is being recorded for later viewing and is currently live streaming via Facebook and YouTube. I would now like to introduce to you Lifespan's CEO, Max Winograd.
This is our first ever of what I anticipate being a regular event for us and for our community, where Lifespan is looking to engage with so many of you in the community to help create more thought leadership, ideas, connections, and learning so that each one of us can help one another, our family, our loved ones, and the community, as Stephen said, live the best day of their life every day of their life. So before we kick off with our amazing speakers, I just wanted to say hello and thank you to everyone that is participating today. I'm really excited for the learnings that I'm going to anticipate getting today and tomorrow during these two sessions. I'm also excited to see what we can do together with our community to help everyone age well with resilience. This is something that is very important to me. It's very important to everyone on the Lifespan team. And I know it's important to you because you're here showing up to learn and to connect. So more than that, I wanted to thank everyone for taking that time, all of our amazing speakers who are here today and tomorrow. And I just lastly want to encourage everyone to be active and engaged here. Ask questions, connect afterwards with us and with the speakers so that we can continue to elevate the discourse around serving older adults in our community and some of the most vulnerable, especially during a pandemic, but any day of the year. And more than anything, make sure that you vote on November 3rd, have a plan to vote, make sure everyone that you know and love has a plan to vote. And also a final plug that we are still working to raise funds for the fight against Alzheimer's and building off of an amazing, although different walk event this year that we had last month and some amazing fundraising progress that Lifespan and so many other community partners have been doing. I just want to encourage you that if you're able to, please consider making a small contribution towards the fight to end Alzheimer's. It's so important for our community that we continue to fund amazing research and advocacy. And we're going to learn a little bit more on those topics this next 2 days as well. So without further ado, I'll hand it back to Stephen. Thanks again, Stephen, for your leadership here, to Francie as well, our community liaison for all of her work on the fight to end Alzheimer's, as well as in making this possible, to James and all the folks that are behind the scenes, making sure that this is a flawless event. And lastly, to each one of you for being here to learn alongside us and to ensure that this vision for everyone to live their best life can become a reality.
And I want to thank you also on behalf of the Lifespan team for your leadership during these very difficult times. You are certainly inspiring, supportive, and truly appreciated. Thank you so much. Now, my friends, Lifespan is honored to have Dr. Elizabeth Landsberg join us this morning. Dr. Landsberg founded Elder Consult in 2006, which provides house calls to address the challenging medical and behavioral issues facing older patients and their families, particularly those with dementia in the greater San Francisco Bay Area. She is also triple board certified in geriatrics, internal and palliative medicine. Please help me welcome Dr. Elizabeth Landsberg.
So thank you so much, Stephen. I look forward to sharing this time. And actually, with everything that's come up, I've kind of mutated my talk. So I'm going to be talking about something a little different. We'll be talking about COVID, supplements and anxiety. Let me get this up. Can everyone hear me? Yes, cool. Okay. So, well, I would say that, older individuals are more in the news these days than they have been since the Gray Panthers. And I've got, good news. And, it is scary out there. I think I'm going to start out with, I'm not going to sugarcoat it. COVID is much more serious for elders than the flu. It is something that, actually, I've been in medicine for over 20 years. I do house calls in the San Francisco Bay Area, and now we're rolling out online health education. So I've been thinking a lot about how do we present what folks need to know in a very short amount of time. The good news is that there are powerful preventive measures, but we still have to protect ourselves. We can't go about our lives the way we did before. Unfortunately, we can't do Thanksgiving the way we did before unless, and I'm sure you're all familiar with bubbles, unless all of your family is in your bubble, that you live with your whole family all the time. If you've got grandchildren or children that are going off to school, if they come back, you've got to be careful. They need to quarantine for 14 days. The good news is we have better testing, and we'll talk about that as well. So we all know that it's important to wear masks and have our social distancing. And even if we have the testing, the masks and the social distancing are really powerful. Even poorer countries such as Thailand or Vietnam have got a much lower rate of COVID infections and deaths than we do, because they are following these protocols. So let's talk a minute about masks. Masks are the N95. That's what I wear when I go into medical situations. And I got to say, it's been about 6 months now, and I've been scared, but I still do house calls. I still go see elders in nursing homes and hospitals and assisted living or dementia care communities. When I am working, I wear my N95 mask. That should be a very tight fit. And for those of you working in elder care or in medical settings, that would be a good thing for you to be wearing. The little paper surgical masks or the cloth masks are good for not spreading the virus, but they're not as good as protecting you. Like if you were in that motorcade sealed in with a contagious patient, you'd want to have an N95. You wouldn't want to just have a regular surgical mask. It protects you better. The social distancing, it's one of those things where if you're meeting your friends outside for a little picnic and you have your own food and you're 6 feet away, that's great. It's not so good for you guys to be inside at a bar 2 feet away and talking for an hour and a half. They now think that particularly being in indoor, poorly ventilated areas for more than 15 minutes really increases your risk of getting the infection. Testing and contact tracing is critical. It's not one of these things where you're not safe if they just take your temperature and the people that come in your building don't have a temperature. There's a lot of young people who have minimal or no symptoms and don't know they're infected. Those are the people you really have to watch out for. And economically, we do much better if we found those people, got them to quarantine, followed their contacts, got them to quarantine and shut down the virus so the rest of us could get back to work. And as I said, it's important to avoid the prolonged indoor contact. So what is all this about age? If you're over 50, the death rate is about 2%. For those who are, in their 20s, it's less than 0.5%. But for those in their 70s, the death rate is 8%. And for those in their 80s, the death rate is 15%. The other risk factors are obesity, smoking, vascular disease. So no one should be smoking anything. Nicotine gum is a great idea. I hear a lot about, can't we just take supplements? Can't we take vitamin C and protect ourselves from it? And it's actually disappointing that I see a lot of doctors taking advantage of this. And part of it is that fear leads us to try and find something to keep us safe, even if it actually hasn't been proven. And in medicine, the way we know something works, and the reason that it's taking a while to get a vaccine is you have to test it out. You can't say, oh, I saw this work in my Uncle Joe, so I know that it works and I'm going to give it to everyone. You have to do a randomized test where you try it in half the patients, but no one testing knows who got the real test item. And then you follow the outcomes. And if the outcomes are better if you got it than if you didn't, then it's a good treatment. And that doesn't happen with a lot of supplements. So what I look to is, when I think about supplements, I look at the NIH, National Institute of Health, complementary and alternative medicine site, where they have done the testing. And there, for something to be approved by the FDA as a medication, it has to show safety and efficacy. There's no regulation of nutrients, vitamins, and supplements. So you don't even necessarily get, if it says it's fish oil, it might be canola oil. They don't have to prove that what they're selling is what they give you. So I've heard a lot about, okay, vitamin D. If you have low vitamin D, it increases your risk of the COVID. But most people have an okay vitamin D. This is my plug for elders. Elders should be checked for vitamin D and vitamin B12. A regular multivitamin hasn't really shown to help. Vitamin C has not shown to help. But vitamin D you want for keeping your bones strong, and vitamin B12 you want for your balance and for your nerve function and for your thinking. So vitamin D, it's really good for osteoporosis, but it's not really going to make a difference whether you get COVID or not. Zinc, for some reason, the alternative doctors love to sell zinc and magnesium. And magnesium can be helpful too. It's really good to help treat constipation, but it's not really a thing. It doesn't really magically make you stronger and better, unless it's kind of one of those things like stone soup, where it's not the stone that you put in the pot with all the vegetables and the water and the salt and the herbs and spices. It's everything else. So if you take magnesium or zinc, but it keeps you doing your yoga, keeps you doing your Zumba with Jamie, keeps you eating a good vegetarian balanced diet, and keeps you exercising, then it's okay. The problem with zinc is it can be caustic to your esophagus. It can, like vitamin C, they can give you gastritis and make you not feel so good. So it's not a thing. Elderberry, not a thing. Hydroxychloroquine. You'll notice even the president didn't take it. He took it before when he thought he got exposed, but he didn't take it when he was sick. They thought that maybe this would be helpful, but again, they actually did the studies and it didn't prove to be helpful. So there are no supplements. It's disappointing, but going back to the basics, we can keep ourselves safe. If you use your mask all the time when you go out in public, you limit your contact with other people outside of your bubble, most everyone stays really quite safe. So the immune system, as I mentioned, what does help? Exercise. It's important to do 30 minutes, and Zumba is a really fun way to do it. I tend to go for a walk at the end of the day to kind of chill out. But exercise helps you improve your immune system, and it can decrease your risk of dementia. That and a vegetarian diet can decrease your risk of dementia by 80 to 90%. So that's pretty powerful stuff. it's important to address stress. And I don't mean getting a pill that says cortisol management. I guess the big buzzword these days is treat your cortisol, and it's not a thing that supplements make better. It's a thing that if you're at home and you're at risk for abuse, that you take the steps to find a social worker or reach out to Adult Protective Services to get help for yourself. If there's stress in your life, that you work with a therapist or talk to your doctor. Minimizing alcohol. Alcohol is a real immune depressant. And so it's okay to have a glass of wine. You know, the French and the Greeks, I was just reading about this in Blue Zones, they have wine every day. I gotta say, I'm Norwegian. My body doesn't feel very good after alcohol, so I have wine with nice meals maybe once a week. But you don't want to be having several glasses of wine and or several glasses of alcohol, and you don't want to be using it to manage your stress. It can make you more anxious. It can mess up your sleep, and it can harm your immune system. So the other thing that you need is regular sleep, which as a woman of a certain age is a lot easier said than done. I'm finding that I can't have any caffeine. I can't have any alcohol. I have to go, exercise, but I have to walk like 6 miles, or I have to bike 22 miles to kind of chill out my body. And then I still find myself at times waking up at 3, and I've tried medications. I tried melatonin. Unfortunately, it can make you have a hangover and be sleepy during the day. That doesn't work for me. So what I do is I just try and have a good lifestyle, and then I wake up and I read for an hour and I go back to sleep. Sleeping pills, we got to watch out, because Ativan, Xanax, Klonopin, which sometimes the doctors will give you for stress and anxiety or for sleep, cause so many problems. They might be associated with increased risk of dementia, but they are also addictive, and they may make you feel better for a while, but then as they wear off, particularly Xanax, it can make you more withdrawn, more agitated, more confused. And those elders who have dementia, it's a disaster. Actually, you might look at my website, elderconsult.com/medications. It has a lot of information on these sorts of things. What does help? Well, as we saw with the president, remdesivir. It's an antiviral, and when you can get it, it seems that it mutes the virus reproduction, kind of like Tamiflu does for the influenza, and it can help decrease the length of symptoms, but it hasn't been proven exactly what it does to the death rate yet. Okay, steroids, that is a strong immunosuppressant, and they're thinking that the bad inflammation that really makes the lungs fill up with fluid is the immune response, and in those people, that's when the steroids can help decrease the inflammation and has had better outcomes. The COVID antibody looks really pretty cool. The studies are still ongoing, and you and I can't get it. So back to masks, social distancing, and staying safe. So as I was saying, this is a very anxious time. I'll admit it. I've been anxious. I've been anxious for my patients. I've been anxious for my family. I've been anxious, as running a business. And so the things that I find is I look for more support. I have consciously made more time to get together with friends, and now it's not as easy. You can't just drop in, but I make a date for us to go for a walk out in a park. Went up to Golden Gate Park to go look at the dahlias and listen to the music, and it was really nice. We were social distance with our masks, and we were outside. Cool. So being with people is important. If you find that you've got ongoing stress, having a therapist can be really helpful. As I said, exercise, enjoyable activities. As far as sharing meals and the upcoming holidays, you're probably asking for trouble if you have your whole family come for Thanksgiving dinner. What I'm planning to do is we're planning to do a Zoom meeting, and get all the family together. But my dad's 87. I don't think that's a good idea for all of us to do that. And there's other people in my family who have diabetes. That's another medical condition that can increase your risk of COVID. So right now it's just not worth it. We have gotten together with other families, and instead of sharing a meal, we went walking down at Filoli or at beautiful gardens. As I said before, avoid the Xanax, the Ativan, the Klonopin. Don't just treat your anxiety with pills. And the therapist can be very important. And antidepressants can be helpful for anxiety, but not every antidepressant is useful in this situation. Some antidepressants can cause more anxiety. Something like Prozac, bad news. Cymbalta, Effexor, I've seen make a number of particularly older people more on edge. So again, on the website, we have the page on medications that can tell you, the most useful syndromes that they're useful for, and that it can tell you the most common side effects. So again, it's best to have family gatherings outside. I can't advise you to fly right now. It's, if you're going to do something, I'd say get all your food together, drive to a rental cottage where there are not other people around, make sure all the windows are open, stay there for a few days, and then come back. You could have several houses and then just meet socially distanced with family. That's possible, but everyone can't be in the same house living together. That's just too risky right now. And it goes without saying that, gatherings in bars is really not a good idea right now. So that is the biggest that I had to present, but I also want to have time to talk about any concerns you all had. So I'm a geriatrician, and my specialty is taking care of behaviors, complicated medical situations, but I also do a lot of work with pain and about healthy living. And I realized that I think I talk too fast because I've gone through my material a little early. But Stephen, I don't know if it's possible to open up the questions in a minute. So we're developing more more online education. We're in the next month or so, we're rolling out one-to-one education where you can sign up for appointment, kind of like telemedicine, except for, that's so complicated. I don't think I feel comfortable prescribing medications for someone I'm never going to see. But that I am very comfortable speaking to someone and saying, oh, taking Motrin or Naproxen every day is really not a good idea. And here's the reasons why, and then writing that up for your doctor. We have monthly workshops the last Tuesday of the month with therapists and myself to support caregivers and talk about the challenges of caregiving. And then you can always put a question through for free at community chat. Anyway, I think, you can ask, we can have an AMA, you can ask me anything. Stephen, should we open things up and open the chat line? Oh, you're gonna have to unmute yourself.
Yeah, thank you, Dr. Landsberg. Can you hear me okay?
I can.
Great, thank you so much. So yeah, I'd love to just invite the audience, those that are watching, to ask Dr. Landsberg any questions that you would like to ask related to her practice, related to COVID-19, as we're awaiting our next presenter to join us. So feel free to use the Q&A function down at the bottom of your screen. And as those come up, we will address those questions. We've got plenty of time.
Yep.
So I do have a question from our COO, Ashley. With social opportunities not an option at this time, what do you suggest for older adults to stay social? Great question.
What I've seen, there are opportunities. I'm a huge fan, like locally, some of the elders get together and do Tai Chi outside. You can still get together. I mean, I think, and I've also seen people have support groups online. So you can either do a Zoom gathering, you can do a gathering in place. Everyone, and I love singing. I was just thinking doing Tai Chi with everyone like 10 feet apart is safe. Having a choir practice 10 feet apart probably isn't enough. But you know what? I've seen choir practices on Zoom. They're really cool. So, and churches, my cathedral, Grace Cathedral has online services, and they have an online coffee hour. So, I don't think we should feel stuck. Let's see, someone was asking about curcumin. So curcumin related to, there is a lot of buzz out there for a number of these things. Curcumin is useful in cultures that don't have aspirin, because curcumin is mainly a blood thinner. And so the idea that it prevents dementia comes from the fact that, just like using aspirin, you're less likely to have a stroke. And in the cultures where people used it a lot, they were less likely to have a stroke. But curcumin itself does not prevent dementia. You know what, we can flip over. I mean, up there with COVID, the next thing that people are most afraid of is dementia. And, it's one of these Buddhist things that we, sorry, I've got my Q&A right in front of me, which is a little distracting. There we go. That we're part of the reason that we have a problem with dementia is that we're living longer. Folks in their 60s are only 10% likely to get dementia. Folks in their 80s are 30 to 50% likely to get dementia. And so part of it is we're living a lot longer. If we can do things that are healthy for our heart and our brain. Let me see, I have to get my favorite book. Oh, here it is. Sorry. There's a lot of magical thinking out there that, if you do just certain simple little things, or you take 30 supplements a day, that you'll prevent dementia. These folks are the real deal. This Dr. Shirzai, and I have no connection with them, except I've met them at several conferences where we're both giving talks. And basically they have the studies to prove it, that if you have a mainly vegetarian diet and exercise, you can prevent about 80 to 90% of dementia. Cool. But you know what that means? That's hard. That's harder than taking a bunch of supplements and sitting on the sofa. I know I have been struggling with losing 5 pounds. You get to a certain age and it's hard to get back into shape. So I've been working on having a more vegetarian diet, and I've been working on making time for exercise. So those are the sorts of things that I would advise that you do. There are doctors out there, and I just have to say it, that will say, no, I have the magic treatments. And it's going to be, and this has happened to families I've worked with, it's $5,000 for the testing, and they test all of the stuff that really doesn't affect your outcome. And then it's $5,000 for 6 months of care, where they want you to take 30 supplements a day. And that doesn't do it any better than, I have my other book, Blue Zones, where they looked at communities where they had centenarians who were healthy and strong and independent. And Stephen, guess what the most common factor was in the Blue Zones?
I actually have no idea. What was that?
Not to put you on the spot, but it makes it more interesting. They're usually, it's Sardinia, it's Okinawa, it's Loma Lindy. I'm not quite sure why it was Loma Lindy, but it's areas where they had very simple lives. They didn't have cars, they didn't have fast foods, they had whole foods. They couldn't afford that much meat, and they had to do a lot of physical work. So it's physical work, it's avoiding processed foods. Gluten, for a few people, is a thing, but having pastries and bagels and pasta and white rice is a much bigger thing. So if we have a whole grain diet, mostly fruits and vegetables, and it's good to have, well, you can have some fish. I gotta say, for special occasions, we're going to have lamb or steak, but we have it just a few times a year. So that's actually the secret of life. And it's so simple and it's cheap and it doesn't feel special, but I don't know. How's that sound, Stephen?
Sounds perfect to me.
You, but you're right there.
In fact, somebody in the side, Scott Thomas, brought up about Loma Lindy, suggesting that it's because of Seventh-day Adventists. I'm not sure.
You know, I'll have to go back and read that chapter. That there are cultures where, you know, they live a more simple lifestyle, you know, like the Quakers. So I'd have to go back and read that. Actually, there are studies that show that folks who stay active in their church stay healthier and more independent. And there is something, as you were saying, it's very important to stay connected. The thing that is killing me is I've seen in some of these assisted living communities, and understandably, where they have outbreaks of COVID, everyone has to stay in their room. But these people have been stuck in their room for 5 months. My heart goes out to them, and it can make you just feel like you're cut off from the world, because you are. And I'm really appreciative of a number of these assisted living facilities where they are working to get families to meet. You know, like I'm the medical director for Silverado in Kensington, and they're working to get people to meet outside, you know, 6 feet away across the table, but to say hello. And I've seen those pictures where you can even have, you know, the plastic shield and the arms so you can hug people. All of that's really important. Yeah,
Dr. Landsberg, if I could interject just real quickly, Scott also asked about thoughts on flu season in addition to the coronavirus. And I just want to mention to you, Scott, that come back tomorrow, Dr. Arthur Dover will be talking about the intersection of flu and COVID-19. So keep that question and we'll address it tomorrow. I think I saw another question here, and I apologize if you've already responded.
Outside dining, I see one here. Outside dining, bring your own plates, napkins, glasses, how much food to share? You know, so now they know that, like particularly for schools, everyone's spending a lot of time wiping down surfaces and such like that, when they really need better ventilation and HVAC systems, because they're realizing that you need to circulate the air 6 times an hour instead of 3 times an hour. I think the safest thing to do is BYOE, bring your own everything, and then sit close to other folks. You know, another thing you could do, I was thinking about this, it's like, I miss my friends, I miss my family. You know, maybe we could just take out pizzas and just put the pizzas, and everyone, you know, each bubble brings their own tongs. So you just take the pizza slices. It's best not to share a lot of stuff. And for elders, I'm not recommending going out and eating outdoors at the restaurant. I'm recommending getting takeout and then, you know, using your hand sanitizers and eating at the park or eating at home. Let's see, there's a question from Suzanne of how socially distant. You know, good question. It depends what you're doing. If you're singing, you know, you probably heard about the choir in Washington, where one guy singing for 2 hours in a group infected like 87 people, but they were all, you know, standing together. So we know that the aerosol can go more than 6 feet. It depends what you're doing. If you're outside walking and there's air circulating, you're probably fine. If you're inside, you probably need more distance, particularly if you're singing or yelling. So
Dr. Landsberg, I had a question handed to me from the virtual studio audience I'd like to share with you, if you don't mind.
Sure. Ask me anything. Watch out, Reddit.
Be careful with that.
No, that's okay.
The studio member asked, she recently gave a high noon presentation on a palliative hospice care. Can you please say a little bit about each and when each might be appropriate? Great question.
Okay, well, thank you for bringing that up. So yes, I am not a social media natural, but I wrote a handbook on dementia, and I was told I have to have a social media following, so to sell a book, which I recently did. Okay, but I'm now doing High Noon with Dr. Liz and Friends Saturdays at Dr. Liz Geriatrics. And yes, I was talking about hospice and palliative care. And I think we need better palliative care for everyone all the time, full stop. Like, what I mean about that, I'm not talking about death panels. I'm not saying we're not going to, try and cure and make elders whole again. What I am saying is the other thing besides people being isolated in rooms by themselves for months that just really cuts out my heart is this idea that narcotics or the effective pain medications can never be used for elders or anyone. What do I mean about that? And yes, there is a narcotic epidemic, but that is more younger folks. They come into it because they're playing, they're partying, or they're emotionally distraught and they're self-medicating. For elders, they're not the ones that are usually drug seeking. What I have seen is even people who break bones are given Tylenol as needed, and they try and give them antidepressants like Cymbalta, which that is not a replacement for proper pain management in elders who either have a broken bone or severe spinal stenosis or bone-on-bone arthritis. So it's appropriate to have good palliative care from day one, because as we get older, as I found out, I've got like thumb arthritis, which sounds like a little thing, but it's really a problem. I've got arthritis of my foot, and I don't take medication for it, but I have to work around it a lot. And if I'm having a bad day, it can affect my whole day. Actually, as we're talking about the medications, another big plug I want to put out there is it's not okay for the doctor to tell you that you take Motrin and Naproxen every day for your pain control. It is not safer than a half of a Norco a couple times a day for serious bone-on-bone arthritis or broken bones, because those medications, the Motrin, the Naproxen in that family, non-steroidals, increase the risk of heart attack, stroke, GI bleed, kidney failure, edema, heart failure. So as elders, we have to be more careful of our medications. That's part of what I'm putting in a book. Then hospice. Hospice is mainly when you have 6 months prognosis or less. Well, how do you know you have 6 months? There are, particularly for cancer, you can pretty much tell. They have algorithms to use. For heart failure, it's a little bit more difficult. And for dementia, it's really quite difficult. But if the function is really declined and they're not eating very well, that's probably a sign that they could qualify for hospice. And that's another bugaboo that these days, the hospitals, so I often get called in for folks with dementia and difficult behaviors. The hospitals get dinged if someone that they've seen in the emergency room, and with my patients, it's often because of behavior, if they come back within 30 days. Well, if their behaviors aren't well controlled and they come back in 30 days, I've seen more lately that they've been ushered onto hospice for what is usually a medication problem. And that's not okay. Again, that's why I say avoid the Xanax, the Ativan, and the Klonopin, particularly for elders, particularly for those with dementia, because it makes their behavior worse. But hospice can be a great service. It allows people to stay in their home. It allows them to get care and support where they need. It allows them to have a nurse to see them night or day when they need it. I've been a hospice medical director, so I think it's a terrific service. And we just need to know when to use it.
Great. Thank you, Dr. Landsberg. And also for you in the audience here, if you come back tomorrow, we have Vanessa Silverstein with Hospice of Santa Cruz County going to be present with us. So make sure you take advantage of that opportunity. Dr. Landsberg, it looks like there's another question. I don't recall it being answered. And from Suzanne Dowling, she'd like to know how socially distant in terms of distance, and do plexiglass shields actually work?
Well, I spoke a little bit about that, it depends if you're singing. It depends if you're, indoors, outdoors. So if you're indoors, you need more space between you. If you're out of doors, particularly if there's a breeze and you're moving. 6 feet is fine. If you're indoors, you probably need more. Plexiglass shields, ugh. I don't know, I see them in the restaurants. I'm not gonna do it. I'm too old to do that. So I don't think we have the studies on that yet. I think we do know that particularly indoors, no mask, 15 minutes, not good. Being in bars where people are drinking and get less inhibited, probably not good for us older people. And I put myself in that category. You know, I'm thinking about where I'm going. I'm thinking about what I'm doing. If I okay, I want to get my legs waxed. You know, that's one of those nice little perks, but it's just like, oh, what's the trade-off? So I made sure that I got the first appointment of the morning and then I got out of there. Or, you know, when going to Costco, I'd go early in the morning. So those are things that I do to kind of work around exposures and plexiglass. Oh, so the plexiglass shield where you wear it, I mean, basically we wear that in the hospital so people don't spit on us, but that will not protect you. That is not nearly as good as a mask, and neither of those are as good as an N95 mask.
Great, thank you. Jeannie or Jean Samari, I'm sorry if I destroyed your last name, didn't have a question, but she just wanted to say, great talk, thank you. And there was another one, that last one that came in, and again, I apologize if you responded to this from an anonymous attendee, regarding bubbles. What do you recommend?
Oh, well, so actually, you know what, after this, if I've got time, I get to play with the audience. So bubbles are the people that live with you. And, you know, this is going on forever. And so my heart goes out to families where there's a working mom with kids, and, you know, kids in grade school, not being in school is really tough. I like the idea of pods. You know, it increases the risk somewhat, but if you've got everyone in their 30s or with kids, and you have a couple other families that you guys, you know, it's kind of like a monogamous relationship. You guys agree not to do risky things and bring it into the group, then that's a way to have someone to watch your kids, to have a teaching pod with. I see up here at our rec center, you know, they had the summer camp, and they've had programs for grade school kids. Now, be clear that grade school kids still can transmit the disease, but they're less likely to get infected from it. So, you know, I don't know all the particulars of how this transmission works, but I think the biggest thing that I'm concerned about, like in the schools, is the effect on the teachers, because they're more at risk than the kids. And then if the kids get it and then they bring it back home, and then the way to express it best is there was a woman from church whose son was out working as a frontline worker. She's got diabetes, her mom's got diabetes, her daughter was pregnant. So the son got it, you know, didn't mention anything to the family, came home, was coughing in the house, and then everyone got sick. So it's very contagious. Yeah, beware of anyone under 30.
Sure. I also, just my personal experience is, you know, it takes a high level of trust to create those bubbles. And since rapid testing is not an option for at least the average person like myself, you know, it really is, for me, you know, not creating a social bubble of sorts. Just gratefully, I have a spouse that I cohabitate with, so there is someone I can relate to. But folks like an older adult who don't have, you know, family local, definitely can lead to that increased isolation, depression, other mental health challenges that they may already be experiencing.
That's a good point to bring up. I mean, I think that one of the things to look out for is our friends and family. So the symptoms of depression, it's feeling guilty, it's eating too much or too little, sleeping too much or too little, it's not enjoying the things you used to enjoy, it's feeling hopeless about the future. You know, if you see those things, it's important to try and get them connected either with a social worker or adult protective services or their doctor. Actually, older white men are most likely to kill themselves if they get depressed. And if there's a gun in the house, 90% of suicide attempts work if they have access. And if there isn't, only 4% work. So it's important to kind of think about all those factors. I mean, I know that's kind of a serious thing to think about, but it's a thing.
We're in serious times.
Yep. I have a question for the audience. What have you found helpful for you for getting through the last few months? I want to hear from you.
While their mics are muted, if you'd like to answer that in the chat
Or they
function.
can, yeah, they can do it in the chat box.
Folks, I will do my best to keep up with the responses. You want to answer your question or ask your question one more time, Dr. Landsberg,
Oh,
please.
so what have folks in the community or in the conference found to help them during this time? Working out.
Yeah.
Definitely, Vanessa, that sounds great.
FaceTime and Zoom helps. Scarlett.
I'm doing a lot of FaceTime. That's easy.
We never thought we would Zoom as much as we are, right?
Right. Well, every time I go see family, I go see elders, particularly the ones who are stuck in assisted living, I try and FaceTime the family so the elder can talk to their family, because sometimes, you know, the facility is just not set up for it. Chocolate, yay.
I love Suzanne's response. I'm assuming picking up a new talent, learning a musical instrument. That's awesome. Staying creative and engaged for sure.
You know what I'm doing?
Yeah, streaming live musicians. Can't go to concert, but that helps. Amen
Right.
to that.
This isn't like really fun, but you know, I spent 20 years as a single working mother, and you know, true confessions, I wasn't the greatest housekeeper, and now I'm like living with my stuff. And I spent several years giving talks all around the nation, and I've got about like 42 little bottles of hand lotion. And I'm realizing I need to like get rid of those. I have, you know, 8 bottles of olive oil and all these things. It's like, oh my goodness, now I'm organized. Now I'm doing my inner Marie Kondo's coming out, and I'm getting rid of a lot of the excess stuff. And it really feels good. I mean, I'd rather not be here. I'd rather be out at a concert, out at a play, out with friends. But since I can't, I'm getting organized.
They're having some great comments on the sidebar there. Gardening,
Yes.
absolutely. Music, dance. I love fostering kittens. That's awesome. Love that. Watching TV shows, Marie Kondoing, that was mentioned a few times. That's an excellent question, Dr. Landsberg, and so great to see that everybody is taking advantage of this me time to do some me things. Cooking, I love that. I'm a baker, so making a cake or cookies is good for me and my stomach. I think we had a couple more questions come in the Q&A, and then we'll wrap up there, Dr. Landsberg, with your permission.
Sure.
So Yvonne Atwell would like to know, for disposable masks, which are not N95,
Right.
is it okay to reuse them multiple times, or do we need a new mask each time we go out? That's a great question.
The official answer is it's best to have a new mask every day. Me, I toss it in the back of my car and then I wait 4 or 5 days. I have different baggies, you know, with the, I did that at the beginning because I bought boxes and boxes of masks, and then someone stole 200 masks from my office. So I just had to make do. I think if it gets soiled, or definitely if you're in a situation where, like if I go see someone and they're coughing, I get rid of everything. I go home, I take a shower, I wash my clothes. If I'm just doing my day-to-day, then if the mask is looking okay, I might use it again once or twice. You know, it depends what your exposures are.
Right. Thank you. The last question I'd like to see if you have a response to is, who would you drive with? And to add on to that, how do you protect yourself?
Who would I drive with? Oh, only people in my bubble. So I've also been a mentor, and I finished this spring, you know, for, I had a nurse practitioner interning with me so he could get his license But once, the shelter in place went in force, I had him drive. So he and I would drive the same route 8 hours of the day, but we'd take 2 cars. I'm not going to have him in the car with me. I mean, as much for his protection as for mine. I would drive with people in your bubble. That's why it was so uncomfortable watching the Secret Service having to drive with someone known to be COVID positive. That's not a good idea. When someone is COVID positive in your family, let me just say this really quickly. They need to be isolated. If they're not that sick, it's best to have their room, their bathroom, open the windows outside, slip the food in, have them slip it back out, but they stay that way for a week to 10 days and you do the testing. It's getting easier to get testing, and I am happy to say that assisted livings are now testing like 25% of their staff and residents every 2 weeks, which makes the likelihood of catching people with COVID much improved. And that decreases the amount of infected people out there. So, Stephen, this was great. We're developing much more online education at elderconsult.com. We're going to be doing one-to-one education, and I'm always there Saturday at high noon with Dr. Liz and friends.
Great. Dr. Landsberg, thank you so much again for being present today. And your presentation was not only insightful, but thought-provoking, and really appreciated the opportunity for the the Q&A session we were able to have with you. It's not often you get that much time with the doctor, right?
No, well, I forget how fast I talk. Have a good one. This is terrific. I appreciate it. I look forward to the other speakers.
Great. Thank you so much again, Dr. Landsberg. I appreciate you. All right, folks, thanks for the great questions and comments during Dr. Landsberg's presentation, and jumping right in there with your thoughts on how you are managing your anxiety potential and stress with COVID-19 and being sheltering in place for the last 6 months. So keep those questions coming to our other presenters. Next, I am very pleased to welcome Aging Life Care Association CEO, Tawny Hamel. Tawny comes to the table with years of experience in the aging field as an accomplished senior executive in associations, profit and nonprofit environments. Today, Tawny will be sharing about how care managers can help support our older adults. Tawny, thank you for showing up early. Really do appreciate that, jumping in. The floor is yours.
Thank you. Thank you very much. Thank you for having me. Thank you for asking Aging Life Care Association to participate. What I'm going to do today is talk about what a care manager is, or how we view it, or how we take the message out to what care management is, and then talk about why people should join our association and what kinds of things do we have available for them. My quick history is I worked for the Visiting Nurse Association of America before this association. I also worked for America's Health Insurance Plan, so understand the payer a little bit. I've also worked for an accrediting organization in managed care, URAC, and I was on the Case Management Society of America's Foundation, a local hospitals foundation, and I started my career in an area agency on aging. So I think all those things have brought me here today to Aging Life Care Association. Next slide.
I don't think, oh, there we go. Thank you, James.
So the association, or the profession, the association came along a second to the profession. The profession was out there. People were doing the work in the early 80s of helping take care of the elderly when their family wasn't around. And there was an article done by the New York Times that brought some care managers together from across the country, and they had their first annual conference. This year, we celebrated our 36th annual conference. So we've come a long way with conferences and education. In the mid-90s, a number of the care managers that were involved in leadership decided that we needed an academy of certification for care managers. So they formed the National Academy of Certified Care Managers, and the credential was born, CMC. And this is the credential for care management, even though we recognize other credentials in this field.
It's really kind of tight at the end of the day.
Then in 2015, we rebranded. And now today we are Aging Life Care Association. And we are celebrating this year in 2020, our 35th year in operation. So pretty exciting time. And we've been showing a lot of videos of a lot of the founders or the folks that have been around a long time. Kathy Crest has been significant in helping us with that. What is an aging life care professional? They're highly educated, credentialed professionals, and they provide personalized care. They help with decision-making and support. They follow a code of ethics and standards of practice, which is really important. They are knowledgeable and they have training and expertise in the field. Aging life care, next slide, is a holistic, client-centered approach for caring for the elderly and disabled persons. It improves the client's quality of life, certainly, and reduces family stress. And I'm going to talk a little bit about, as we go through this, they do extensive assessment, monitoring, care managers do planning and problem solving. They do a lot of educating, and they really coach the family. Why are aging life care professionals in demand? We're in the middle of, we're beginning the sober tsunami. The healthcare system, next slide please, has changed. Have you tried to get into a hospital lately? I have. That's something, let alone get into long-term care facilities, assisted living. And there's a growing sandwich generation trying to care for children and parents. ALCA members have 8 knowledge areas. Next slide. And those 8 areas include legal. They know who the local elder law attorney is. They're there for crisis intervention, whether it's family crisis intervention where you need a coach, or it's crisis intervention where the elderly client has to go to the hospital. They go. They are there. They understand what housing is in the area, what's local, when an elderly person needs to go to assisted living, with their personality, which place is the best for them. They know the local resources and they're really there to help the family. How an aging life care professional helps. Professional support, and I talked a little bit about the assessments. Every care manager does an assessment a little differently. Some are a little bit longer than others, but that's something that needs to be done so they can develop a plan and link the family and the client to resources. They ensure that needs are met. They keep the family informed. I rode along with a care manager last year, and she sends weekly notes to family members who are we were in Washington, D.C., and the family members are in Illinois and California. Very worried about what's going on in Washington. So the care manager sends weekly notes. That gives the family a peace of mind. They do ongoing evaluation. They coordinate everything, and they really are the hub to help the elderly person. So when to refer to a aging life care professional? If there's a crisis, family conflict, memory loss, you need an advocate, confused about options, and most folks, until they need it, do not understand the healthcare system, do not understand insurance, do not understand any of it. And all of a sudden, the family is faced with, what are we going to do now? The client profile usually is somebody that's isolated, lonely, confused, worried, anxious, and frightened. Remember, the client is the elderly person. Next slide, please. They're resistant to help. You know, I just want my children to leave me alone. They're depressed a lot of times. And I heard with the physician before me, she talked about depression. Most people as they age at some point show some depression. It's a hard, I have to tell you, this aging thing is not for the faint of heart. So I truly understand why the client profile is this, because it's not easy to age. Next slide. So families call because they are in the middle of being overwhelmed and busy, worried. They may not be there. They're worn out. They need an expert. Experts working with your parents is what is needed. And they go in weekly, they go in every couple of days if needed, or they may only go in once a month. What's needed? That's part of the master plan. Next slide. When should anybody refer to an aging life care professional? When your concerns go beyond your expertise. There's no support for local families. And that's happening more and more. The family disagrees about the next steps. Oh boy, did I not live that with my mother. We could not come to a decision. Yes, we did go to a care manager before I was in this role. You need unbiased information. So sometimes that's the thing you need the most. And our members, care managers, are unbiased. It is hard to be a caregiver. It is overwhelming and it's stressful and you need help and support. And some of our elderly are abused or neglected, and having a care manager can help with those kinds of issues too. When to refer to a aging life care professional? If there's memory loss, is there substance abuse, or you think there's substance abuse? They're sabotaging friends and neighbors or family members, refusing help. Care managers are great at going in and sitting down and becoming the elderly client's best friend. How to refer to an expert in aging life care? I would say build a relationship, first of all. Set up the meeting, get everybody educated, understand the way that you want the care manager to work with your family. It takes a team. If you've ever been to an acute rehab with a client or patient, you know that they work in team. And team is what you need to work with to maintain and take care of your elderly family members. Now, I'm going to tell you a little bit about what we do for our members. Aging Life Care Association's members are nurses, social workers, are gerontologists, they may be counselors, OT, PT, all different. This is usually not the first, I would say it's not the first career that folks have. It's usually the second or third. And why they want to join ALCA, next slide, is because we are prestigious logo and prestigious trademark for our members, and they use it. We provide national networking and local networking through our chapters, and there are 9 chapters throughout the country. We want aging life care businesses to flourish. So we support them, and we support them on the next slide I'm going to show you in a minute in a number of different ways. We set up business and clinical webinars, and we understand that care managers are business owners. Now stop for a minute and think about that. Care managers are business owners or business employees. And that shift to think about they are running a business, even though they have a clinical or social background, we still have to support them both clinically and in their business. I'll tell you one of the things we just started this past year, and we're going forward with it. We brought in a mastermind class. And a mastermind class is a class you attend once a month, and they become like your board of directors. They help you through problem solving. They help you with employee issues. And so we have 2 mastermind groups going on right now. We have an executive coach for each mastermind group. And what we're going to do is move forward with another one next year. Okay, now next slide. So why join ALCA? You want to join ALCA for the Inside Alpha magazine. You want to join because of our journal, and it's now peer reviewed, which is very significant. You want to join us because of the connections, the education, the information, the ability to network not only locally, but across the country, particularly if you have a client that is moving back somewhere or across the country somewhere. I think our members would say that one of the most important things that we offer is a listserv. And they talk to each other on that listserv. They ask for recommendations. They'll put up a case and say, help me with this. And they help each other. During COVID, starting in March, we did over 40 member forums. Those were free. Just dial in to Zoom like this. We had topics. And out of that has come two very interesting forums moving forward. We are doing a solo practitioner quarterly forum for solo practitioners, people that don't have other people working with them or for them. And then we have another one. We have care managers working with children at home. Help, what are the best practices? How can we do that? So those two have come out of those 40 that we did. Next page. So here's the resource overview of the variety of tools and resources, including peer case conferencing. I have a new item that we came up with out of those 40 member forums. It's a folder, and we're trying to get everybody to use the same folder so that if your client goes into an emergency department, they take their information in the same folder. But across the back is Aging Life Care. You would put your client's name here and your card goes inside. The more that we can do this, the more hospitals, when they see this, maybe they'll know there's a care manager involved. You would join Aging Life Care for the same reasons. If you're a nurse, you're a member of the American Nursing Association. If you're a social worker, you're the member of the National Social Worker Association. And most doctors are members of AMA. So the top 3 reasons, next slide, that we see that members join is because of the support, and the support that we offer. Cutting edge information, and they want to grow as a professional and a business owner. Our members transform the lives of their clients and their families. They live the passion every single day, and they enrich the lives of others as they enrich yours. I had to call an Aging Life Care professional in the middle of August, and it helped me get through what I was going through with a family member. And the last time I had to do it, I didn't have a care manager. It sure made it easier. So if you need to know where a care manager is, go to the next slide. aginglifecare.org is the name of our website. You just push on the orange button, put a zip code in, a city or state, and bang, up will come the care managers. Some of our care managers have put their pictures up. The rest of them are being hounded to put their pictures up. But the more, so you can see who you're calling, and you can go to their website and learn a little bit more about them. But this is the way nationally you can find a Aging Life Care expert. I'll take any questions you may have.
Thank you so much, Tani, for that great presentation.
Welcome so much.
Yeah, folks, so again, using your Q&A function at the bottom of your Zoom screen, please feel free to ask any questions you have of Tani in regard to care management. And know that care managers are so important in helping families and seniors navigate the often complex nature of aging. I think that's without question. So chime right in, folks. So someone asked, Tani, do you have articles on your website regarding Aging Life Care?
Yes, there's a number of articles on our website around Aging Life Care. Go to the website and look. There's a lot behind the front of the website too for members on that topic. So if you need some help or you can't find what you're looking for, please feel free to call the office.
Great, thank you. And just from a personal standpoint, in the world of COVID-19 and care management, it does oftentimes, Lifespan is a member of ALCA.
Yes, you are.
We're grateful to be to be a part of that organization. So, trying to visit with a client, care managed client in person, is often fraught with challenges. Is there anything that ALCA does to support perhaps best practices, or any insight on what the best way for a care manager to approach a new potential care managed client in a land of COVID?
We are working very hard at providing some of the new technologies out there. One of the new technologies that we're just starting to offer is SoundBind, which allows the Echo system to be just plug and play into the person's either apartment, condo, or home, and then they can see you, you can see them. It's a new member for us, a corporate partner for us, and they also are doing a little study. We also know there's a number of products out there, and we're trying to get them and make them available, because I think a lot of times you're not going into the home right now. You're not going into the long-term care facility. So you need some way to speak with the client in their home.
Absolutely. Thank you, Tani. Yvonne Atwell asks, are aging life care professionals covered by insurance? And I'm suspecting she's meaning private insurance or possibly Medicare.
The only thing that we know today is that we know that some of the Medicare programs, if you're in the structured program like the HMO, Medicare Advantage, I think it's called, they may pay for some care management services. We also know that we have some members that are billing long-term care insurance and getting reimbursed. The client is getting reimbursed for the services. But on a whole, care management services aren't paid for. I think we're in a place that similar to where case management was a number of years ago, where we are trying to figure out how to get the services paid for. But right now, it's pretty much out of pocket.
Right. Yeah. Usually the most important things that we need as we age are out of pocket, right?
Right. Unfortunately.
We're a little behind in making sure that our older adults have the support that they need, like care management and many other services. I have someone ask, what is the office phone number? Perhaps you can.
And I knew you would ask me that. And so, because I'm sitting here in Annapolis, and of course I don't have it out because I have it on speed dial, but I will tell you in just a second. The general number for us is 520-209-7000.
Maybe one more time on that, Tony, if you don't mind. In case
520-209-7000. That's our general number, and we'll roll through for what you need. For membership, you're going to talk to Sarah. For technology, you're going to talk to Joe. For marketing or PR, you talk to Courtney. Membership is also Callie. And then, of course, Julie Wagner is the Vice President of Operations.
Great.
You can always leave me a message too.
And folks, we've also put that phone number in the chat bar if you missed it in writing it down, so it's available for you there. Let's see. Another person asks, this is a great question. What qualities make a great geriatric care manager?
What qualities? Because they come from every walk of life, I think the best qualities are somebody that cares, somebody that is smart, that has had some life experiences and wants to help. Because I think, as I said, most of our care managers are highly educated. A lot of them, and they've sat for credentials. I think that you have to have a big heart to help take care of elderly clients. And I think that you also have to be smart working with families.
Absolutely. if I can add from a social work perspective, being a social worker and care manager, among many other things, we all definitely wear multiple hats, don't we? I would say absolutely meeting the client where they're at is an important quality, you know, and knowing that where they might be may not mesh with where you hoped or wish they would be, but being patient and you said kind, compassionate, open-hearted are certainly qualities I try to emit when I'm working with a client one-to-one. And also, you know, we're going to be speaking, Francie Newfield will be speaking about caring for yourself while caring for folks with dementia, remembering that if you're working with a client that may be suffering from cognitive impairment, whatever disorder that might be, you know, it's the brain that's broke, not the person, and just being mindful of that.
That's right.
So that's just my 2 cents there, Tony. Thank you for letting
Thank
me.
you. And
interject
meeting the
that.
client where it is, I didn't say that, but that's probably the most important quality.
Absolutely.
So thank you,
Um,
Stephen.
You're welcome. So Miriam Tutman asked, and I think you pretty much touched on this with Yvonne's question, is there any progress getting care management services to be covered by insurance?
I think that's a wide open question. I think, yeah, I think there are two areas of thought on that. If you are being paid by Medicare, you have to abide by Medicare rules and regulations. If you are being paid by privately, then you're not being told what rules and regulations you have to abide by. So I think there are two schools of thought. Some care managers want more organizations, either payers such as Blue Cross Blue Shield or United and Medicare to pay for the services. And some care managers like it just fine the way it is. And of course, we work, we certainly at the office will work whatever we need to do. And we will work with the board of directors on their wishes on what way we should go. If you as a member feel strongly about this, we go into strategic planning in a couple of weeks. Send a note to anybody on the board of directors or me.
Great. Thank you, Tani.
Mm-hmm.
Another attendee asks, are there local chapters in California?
There are local units in California. California is part of the Western chapter, and the Western chapter, and Kathy, I may not get this totally right, consists of Washington, Oregon, Idaho, Arizona, New Mexico, California. Did I forget anybody? So the Western unit is really the western part of the country. So there are units, and you can go on the website and look. There, I know there's San Diego has a unit. I know Kathy is up in, there's a unit where Kathy is. I know that LA has a unit. So just go on the website and look. They're across California. I know that there are a lot of solo practitioners in the San Francisco unit because they got on those member forums and talked a lot.
Great.
And the Western chapter just finished their annual meeting, what, 2 weeks ago, a week ago? And it was phenomenal. So get involved. If you are a member, get involved and meet these folks. They're
Absolutely.
wide open for new people coming in.
I had the privilege of attending I think 2 weeks ago, the Western Region chapters conference.
Yeah, it was fabulous.
Zoom, which was very incredible. Great opportunity to hear from professionals nationally and get some great insights. So thank you for having that, Tani.
Yeah. Well, thank the Western chapter. Yes.
On our side chat, Lourdes Pollard asks, does ALCA offer certification to its members?
The certification is done through the National Certification Academy, CMC. So that's where we direct our members to go get certified. If in all transparency, that organization is back office run by me and my staff, and so it is something else that we run, but it's separate boards of directors and separate companies. But if you're going to become a care management manager, we urge you to get certified.
Great, thank you. So I don't see any other questions that have not been responded to. Thanks everybody for pitching in. Oh, hold on, someone threw in Hawaii and Nevada. I'm not sure.
Was that Kathy? Kathy threw it in. I forgot how could I forget Las Vegas, and how could I forget Hawaii? Oh, and your boss is in Hawaii, of course. How can I forget that?
Great. Thank you, Tawny, again for your presentation. Really do
Sure.
appreciate you
It was fun.
jumping in early here and being ready to
Thank
go.
you.
Definitely, your time is so appreciated.
Thank you. Thank
You're
you for
welcome.
having us.
Of course. All right, folks, as we continue with our first ever Living Your Best Life Aging Well webinar, I'd like to now introduce our next presenter, who is Francie Newfield, Community Liaison here for Lifespan, who's had a 30-year career in programs serving our older adults and disabled individuals. She is an active volunteer and champion for the Alzheimer's Association, and she's going to share with us about taking care of yourself while caring for persons with dementia. So please help me welcome Francie Newfield.
Thank you, Stephen. Welcome, everybody. Happy to be here with you this morning. I'm going to be sharing a presentation that was developed by the Alzheimer's Association last spring when COVID first became a concern, and a particular concern for people living with dementia and their caregivers. I want to give you a couple of statistics before I move into the actual presentation. And that is, many of you may have seen or heard this particular number, but currently about 5.8 million people living in the United States are living with Alzheimer's. This does not count people who have other sorts of dementia, so it's overall a much larger number. But just for these 5.8 million individuals, there are 16 million unpaid caregivers. And the amount of time that these caregivers provide unpaid is 18.6 billion hours of care. And if you were to translate this into paid care, it's $244 billion worth of service. So we're not talking about small numbers here. And again, it's amplified even more so when we're talking about all the other sorts of dementia. And I will just mention that the Alzheimer's Association is committed to supporting people and their family members with all sorts of dementia. Just some of the statistics we have, because we get them from Medicare and diagnostic codes, it's easier to track Alzheimer's disease, which is the most prominent sort of dementia, but certainly not the only one affecting people all over the country, all over the world, as a matter of fact. Next slide, please. So this presentation has mostly three different sections. There's a little bit about COVID-19 and dementia, and I'll probably go over these a little more rapidly because these are most of this is information that many of you already are familiar with. Then tips for caregivers, and these tips are important for people whether or not we were in a time of COVID or some other kind of pandemic. We've already had a little bit of reference from previous presenters about caregivers and the need to take care of yourself. So that's a lot of what this will focus on. And then thirdly, there are many tremendously rich resources available by the Alzheimer's Associations, all of which now are being provided virtually. I will say right now that while our offices nationwide are not being staffed in their physical locations, all the resources remain available and in some ways more accessible to people because they are virtual. Next slide, please. So talking about COVID, there's nothing about dementia that increases the risk for COVID-19, just like there's no connection between dementia and risk of the flu or other contagious illnesses. However, dementia-related cognitive decline and increased age, the typical health problems that older people generally suffer do increase the risk for picking up any kind of communicable disease. And we've heard just recently from Dr. Lansford how very contagious this particular disease is. And because of the cognitive impairment suffered by people with dementia, they may not be able to remember or understand the importance of following the hygienic recommendations that we are also familiar with, washing of hands, and particularly keeping socially distant, which is why, unfortunately, it's important for people to pretty much stay isolated. And that, of course, does have its own negative implications for people with dementia. And we've also seen and heard reports that symptoms of COVID may include some cognitive impairment, even for people who don't have any type of diagnosis of dementia. And sometimes these conditions might last longer than the rest of the disease itself. And so it may worsen if a person with dementia develops COVID-19, it could worsen their cognitive impairment. And that's certainly a concern. Next slide, please. This is just an example of one of the many resources that's available through the Alzheimer's Association at alz.org. This one is /COVID-19. And as you can see from the slide on your screen, there are actually more links than are visible on this with different sorts of information you can click on. And when you do that, you will see a really detailed fact sheet with lots of information, answers to your questions, or questions that you might want to ask in various settings. So I really recommend that you take advantage of many of the resources. We'll be talking about more of them as we move on, but alz.org is a great place to start when you have questions and concerns about many things related to caring for someone with dementia, or if you are someone who's diagnosed in early stages. Next slide, please. Thank you. Individuals who are living with dementia, and if you are a caregiver, of course, we really want to encourage you to stay up to date with CDC guidelines and consider some of these points. I would like to also mention that particularly here in Santa Cruz, our health department puts out lots of really beneficial directives. They have an extremely informative and broad website as well. It's a good resource for yourselves. And they also address issues related to people who are living in care facilities here. So as I mentioned before, any kind of clues or cues, I should say, or tips that you have available in your home to help remind your loved one with dementia to wash your hands frequently, especially if they are having contact with anything outside. I think demonstrating or doing something together, warm up the water coming out of your tap, have some nice soap, wash your hands together. You can sing the happy birthday song 2 times. You can sing the alphabet. You can come up with some other fun way to do this rather than just saying, go wash your hands. And certainly if going to the sink and washing hands doesn't work, we know that using alcohol-based sanitizers that have at least 60% alcohol can be a quick and handy alternative for keeping, maintaining that aspect of hygiene. The next slide, please. For people living with dementia, increased confusion, rapid onset, is often the first symptom of any illness. So if a person with dementia shows a rapid increase in confusion, it's very advisable to contact your healthcare provider. It may have nothing to do with COVID-19, but there are some, reversible concerns that would lead to this type of symptom. We're all familiar, I think, with the fact that urinary tract infections have different symptoms in older people, and confusion is a predominant symptom of that. A problem with medication, metabolic disorders, other things like that can also cause increased confusion. So definitely good to get some medical evaluation of that. The other bullets on this slide, to me, really reflect the importance of having a backup plan for any kind of unexpected event. Here in Santa Cruz and the Monterey Bay area, and if any of you are watching from the North Bay, we have had our very recent terrifying experience with wildfires. And I think we learned pretty quickly that by having a backup plan, having a list of things that should be done if you need to leave your home, things that you should be taking with you, that it can really reduce a lot of stress to have something to immediately refer to. And when you are a caregiver of someone with dementia, you have to be concerned about other changes, particularly if something happens to you who might be the primary caregiver. By the way, 60% of caregivers of people with dementia are women. About a third of them are adult children, and others, are spouses. There are also grandchildren, nieces and nephews, and so forth. But if you are a spouse caring for someone and something happens to you, you need to go have a medical procedure, you become ill yourself, it's very important that you have identified a backup person who really understands and knows the routine of your loved one so they can step in if necessary. We also had just right now, or just prior to this presentation, some really rich and helpful information about care management. Having someone who can also step in and help guide care, work with medical care professionals, be very, very beneficial when a primary caregiver for some reason is not available. The next slide, please. As I mentioned just a moment ago, the CDC has provided guidance to facilities on infection control and prevention of COVID-19, both in nursing homes and assisted livings. These things are changing a bit from time to time, and they also vary based on geographic location, what's going on in a community. And these, of course, they're based on local circumstances, and really important to keep up with. Unfortunately, here in Santa Cruz, we have had a high incidence in one of the local nursing facilities. And so there are extra special precautions going on there. But for the most part, if you have a family member who's living in a facility, make sure that you are in regular contact with that facility to understand what their procedures are for managing COVID-19 risk. Also make sure, if you are a primary caregiver, that not only is your emergency contact available, which might mean cell phone, landline, that sort of thing, and the information of another family member or responsible party who can serve as a backup if you have to be reached immediately. This, I think, goes without saying that if you have any signs of symptoms of any illness, keep your distance from all persons, and particularly someone who is frail and has a weakened immune system. We are very unfortunately familiar with the fact that it's been very difficult, if not impossible, to visit family members who are living in residential settings. And this is, because originally of lockdown, and some facilities are now providing unique ways to be able to visit with your family members, somewhat in person, sometimes outside with masks and at distances, sometimes inside, of course, at scheduled times with barriers of various sorts. Facilities are also generally assisting their residents to enjoy phone calls with family members, video chats, or reading emails to individuals. I know a gentleman whose wife is in memory care, and he's arranged with the activity department to leave a voicemail message that can be played to his wife at a time when she's in a calm and quiet space. And the activity director can hold her husband's picture while the client is hearing his voice. And I think that's very innovative and a really very sweet way to stay in touch. There are other methods to do this if your family member is not able to engage in video chats, telephone calls, and things like that. So work with your facility staff in order to make sure that you're getting updates, not only about your loved one, but what else is going on in the facility relative to protecting your loved one there. Next slide. If you already have somebody living in a facility, or if time has come when a placement must occur, even though this might not be the most ideal time, but there are many circumstances under which, this just must happen when care at home isn't safe or possible anymore. Ask the facility about their quarantine procedures. If there is someone in the facility who's been tested positive or showing symptoms of COVID-19, how are they isolating that person and keeping other people safe? Determine your level of confidence that the CDC guidelines are being followed in the facility. What kind of testing protocol is going on? Dr. Lansford mentioned, and we have been hearing here in Santa Cruz, that the facilities now have much more access to being able to test staff members and residents on somewhat a regular basis, but I'm not sure that this is happening across the board. So this is something that you might want to find out. And if there have been staff members affected, how that's being handled. Is your family member living in a facility able to follow social distancing procedures with or without help, and how is that being managed? In some cases, if people are not ambulatory, they may be safer in that regard, as long as there's management of people who might be reaching out to them. You might ask how many staff members interact with your family member on a regular basis, and is the facility able to somewhat limit the number of people who are providing direct care to your family member. This is, I think, valuable under any circumstances, just in terms of continuity of care, so that caregivers can really be in tune with what approaches work best in caring for someone, becoming a familiar individual to a person with dementia. And then, of course, you want to know, is the facility adequately staffed to provide the level of care that your family member requires? Sometimes there are staffing shortages because, out of an abundance of caution, people are asked to stay at home if they are exhibiting any kind of symptom, whether or not it may be COVID related or while they are pending test result. Next slide, thank you. Oops, I'm trying to get to that myself. I think it's probably not that frequent where people are moving from one facility to another these days, unless someone is moving to a higher level of care or a lower level of care, or even moving home, which we'll talk about in a moment. But I just want to say that there's really no way to know for sure that a new facility will remain free of COVID-19 cases. If you're interested in a different facility, of course, you want to find out if they are accepting new residents, what their protocols are for if they require quarantining in a person's room for a certain period of time when they first move in, and have there been COVID-19 cases in the new facility. Next slide. So I know that families have considered moving people out of congregate settings into family homes. And I know of a couple people actually who've lived in certain residential care or even just senior residences. And because they have, there's so much imposed social isolation in those facilities for the purposes of protecting people, which is really necessary, they are recognizing the negative impact that social isolation and lack of stimulation has, and are bringing people home. But there are a number of questions that you want to ask yourself or consider if you are in this situation. So particularly with people who have cognitive impairment, who may also have need for physical assistance with their care, make sure that you really understand what's involved in their care needs. Discuss very in great detail with the people who are currently caring for your family member, what their needs are. If you are going to bring someone into your home, you need to know, can they dress themselves? Can they bathe themselves? Are they continent? Are they ambulatory? Do they need help with certain transfers or moving about your home? Again, circumstances may have changed since you last saw your family member because of the restrictions that have been imposed. And are the people in your household able to provide the level of care that's needed? Might you need some training or coaching to be able to do that? Limiting the number of people in your household who have contact with a frail and elderly person, that's also something to consider, particularly if people in your household are out in the community, working or conducting other business. Are they able to make sure that they can provide a safe environment for your loved one and reduce the risk of exposure? In some circumstances, you may be considering hiring home care workers. And if you are going to do this, I recommend that you have very in-depth conversations with a home care company to make sure that you understand what their protocols are, how they instruct their caregivers, what kind of PPE is available, what people are required to do, what kind of screening may happen each day before someone goes out on their shift, so that you can have some level of confidence that the agency is also adhering to CDC guidelines. Many home care agencies will have a lot of this information on their website, and you may also want to have these conversations. I would recommend pretty much the same if you are thinking about hiring someone privately or bringing in another relative or family member, to make sure that you are doing the best you can to protect your loved one and yourself if you're bringing someone into your own home. Next slide. This should be the activities at home slide. And again, if you are bringing someone into your home, you're going to have to adjust your usual schedule. And this also applies for the many of you who are, or people that you know, who are taking care of someone at home. This is another handy resource that's available on ALZ.org. This one is /care. And there are 6 or 9 different choices of informational sections that you can look at when you go to this particular page. There are activities, there's communication, there's meal activities and things like that. So you can click on any one of these. This one is activities, and it helps you identify, just for example, a simple daily plan. And I think simple is really the key word here. You need to, of course, keep in mind the skills and abilities of the person who you're caring for, and not expecting too much of yourself or your loved one. I like the bullet here that says focus on enjoyment, not achievement. I think, all of us, or many of us, still make to-do lists, things that we want to accomplish every day. And in spite of our best intentions, things happen, and we don't check off all of the things that we may have hoped we would accomplish during the day. And we can't feel bad about it. We just have to know that this is how life goes, and we have to make the best of it. So be easy on yourself. Make a simple plan. I'm not sure if you can see this real well on your screen, but in the smaller cutout here, it just talks about a daily routine, things you might do in the morning. So in your particular situation, do you and your loved one like to have coffee before you get fully washed up and dressed, or do you like to be dressed at the kitchen table, have your coffee and breakfast, maybe talk about something that's in the news that's positive. Maybe there's a garden festival going on, or some great recipes in the newspaper. That's today's Wednesday, and Wednesday in our local newspaper, there's the food section, there's recipes, there might be things you can reminisce about. But make your day easy and give yourselves breaks, both caregiver and the person with dementia. Also, I think it's really, really important to be mindful, again, under any circumstances, to not expose person with dementia who's easily confused and sometimes not able to tell the difference between what's real and what's not real. Please don't expose people to unpleasant news, TV programs that have violence or frightening events, movies, that sort of thing. Don't look at the newspaper if the information is going to be distressing to your loved one. There are lots of fun things, that you can watch. There are old comedies, which are supposed to be very good for health and building immunity, by the way. So, you know yourselves best. You know what might work, but do keep these things in mind, again, to be easy on yourself and to avoid things that might create distress. This slide is really important, and it harkens back a little bit to some of the things. I'm sorry, I didn't ask you, James, to move on to the caregiver stress slide. Some of the things that Dr. Landsberg talked about in terms of stress, and for caregivers, even more significant. So there's a list of 10 items here, and I'm sure there are more. And it's really important to evaluate yourself when you are a caregiver, particularly if you're a primary or sole caregiver of someone with serious illness or with cognitive impairment. If you notice these symptoms in yourself, and you may notice more than several, please stop and think about it and look at how you might find ways to help yourself. There are lots of resources that are available. And one of the things that has been very significantly studied and documented is that caregivers often put their own healthcare needs aside because they are so overwhelmed in taking care of their loved one. And this can often lead to the caregiver's health deteriorating faster than that of the person they're caring for. And even increasing death at a younger age for caregivers than the person that they're caring for. And certainly that's not what we want to see happen. We all remember in the days when we would travel by air, one of the important things that the flight attendants would tell us is put on your own oxygen mask before you help someone else. And I think that that's a good analogy here. Look after yourself so that you can remain healthy and have enough energy and find joy in your own life so that you can share this with others. I also think of something that a really remarkable dementia specialist and social worker, Wendy Lusbader, used to say in trainings, that people with dementia are incredible emotional sponges, and they pick up on the energy that's around them. So the degree to which a stressed caregiver can take time out or find ways to reduce your own stress so that it doesn't carry over to someone else where you're going to have stress building upon stress, that's, I think, really something to be mindful of. So surrounding this center, which is you, physical activity is something that's really important. And we've heard that also from Dr. Landsberg. There are lots of things that you can do, even if you take just 10 minutes a day or 10 minutes at a time. Hopefully you might have a couple of 10-minute segments, but you can walk, you can do what Jamie helped us to do this morning. You can, I do Zoom exercises online. There are lots of videos that you can watch to do exercise. You can go outside for a short walk, maybe take your loved one with you, or go for a short bicycle ride if that's safe for you to do. Working in your garden, doing Tai Chi, yoga. Yoga is a great thing that's a good stress reducer. So that's one thing. Staying connected, keeping in touch with family and friends, or maybe reaching out to new people. I'll talk about support groups in a minute. But even though we know that it's a bit more challenging to stay socially connected while we're trying to keep ourselves safe, it's important to find those avenues to do that so that you are not isolating yourself and that you have someone who's going to listen to you. Asking for help and support. Sometimes people will say, well, I really don't want to ask my children to do this, or, you know, I don't know what to ask for. Well, it's really important. If you know something that's going to be helpful to you, you can say, could you please bring dinner on Sunday night? Or when you go out to do your shopping, could you take my list with you? Can you pick up something for me at the pharmacy? This way, you know, you are both preventing yourself from having to go out in public so much and asking people to do something specific. And I think people are really very willing to help if they know what it is that they can do. In days before COVID, I remember a gentleman at one of our Alzheimer's workshops saying, this was a man, he was about 90 and he was taking care of his wife. And he found a friend from church who would do his laundry for him. And he said that was like the best thing in the world that could have happened. So, you know, really specific tasks can be so helpful. Let's see, some accessing resources. We are learning, and you'll hear a bit more in the upcoming slides about all the resources that are available from the Alzheimer's Association. AARP has a lot of resources available. Here in our community, we have Health Project Center that operates the Caregiver Resource Center, which exists specifically to provide services to caregivers of people who have cognitive or neurological diseases. And it's a wonderful resource. I really encourage you to check that out here in town. Senior Network Services is our local information and referral organization funded by the Area Agency on Agency and other resources. And you can call them, go on their website to find out about a variety of different resources that are available in the community. So taking time for yourself and adopting relaxation techniques, whether it might be meditation, yoga again, prayer, contemplation, listening to music that is meaningful to you. I know someone else who actually schedules time to put on a set of headphones and listen to classical music. Might be a different sort of music for you, but if you can do this safely and make sure that there's still some supervision available for your loved one, if that's necessary, think of what you like to do, bring some joy into your life, and that will translate to the person that you're providing care for. So it's just more important than ever for you to find ways to take care of yourself, even if it's brief moments. So please take advantage of that. Next slide. This 24/7 helpline provided by the Alzheimer's Association is really an amazing resource. And I might not have mentioned earlier, I'm sure I didn't, that one of the things I do with the Alzheimer's Association is I facilitate support groups for family caregivers. And I've been doing this for a great number of years. And over that time, I have heard testimony from so many family caregivers about the help that they've received from calling this hotline. The number is 800-272-3900. Make a note of it. This is actually how you can get connected with any of our resources. So it's not just something that you can call if you are immediately having a problem right now. Although I will say that one person who attended the support groups regularly and received a lot of benefit from that, she said that she called the helpline one night when she just was beside herself. She said, I was a puddle when I called the helpline, and I was completely put back together by the time my conversation ended. So when you do call this number, and again, you can do it every hour of the day, every day of the year, whether it's a holiday, whether it's 3 a.m, you will be connected with a specialist or master's level clinician who can offer confidential and very well informed support and information to you. They can also then contact the local office in your community to have somebody there reach out and follow up with you. They can help connect you with support groups and all of the other resources that we have available, as well as other resources in the community. It's available in 200 languages, several of which are spoken by people who can answer the phones there, and others where we get assist from translation services. There's also a TTY service available, and you can see that number. It's 866-403-3073. And as I said, you call anytime. There are lots of circumstances that come up. Unfortunately, sometimes a loved one will wake up in the middle of the night, not recognize their spouse that they're sleeping next to, wanting to call the police, saying, "I don't know you, who are you? Get out of the house, you're not my husband, you're not my wife." These are very, very frightening times. So another example is during holiday time, when it's so easy for someone with dementia to be overstimulated and become very agitated. That's another time where I've heard that people have found great support from the helpline. You can also get general advice about legal, financial, and important care decisions and treatment options. So please make note of this number and call that. Next slide. This is about our virtual programs. And again, it's really an outcome of COVID-19 and the need for people to not go to settings where there are going to be large groups or even small groups of people. This is a sampling of the workshops that the Alzheimer's Office or the Alzheimer's Association offers. And typically we've offered these here in the community in live meetings, maybe one or two of these each month. Now, each one is offered several times a month online, and they're offered multiple days during the month, different times during the month. So you can get this information both by calling the helpline or going to www.alz.org. I have attended all of these either in person, and I've watched some of them online, and I find them equally informative no matter how you are accessing them. In many ways, it's much easier now since there are more frequent presentations. You don't have to be concerned about going out in public. You don't have to spend the extra time getting in your car, driving someplace, finding a parking spot to be able to take advantage of these. They're all free. And in addition to finding them at alz.org, you can find more information at communityresourcefinder.org, which is our next slide. Let's have a look at that. This is another web link you can go to. And if you do that, you will find these 6 sections just as they appear here. And you can click on them. So if you click on the Alzheimer's Association, you will find all kinds of resources available there. If you click on medical services, you can find information about specialists, about, say, hospice, home care agencies. Same if you look at care at home, you can find a variety of resources. I should say, it's going to ask you for your zip code. Any of these will ask for your zip code. And then you can click on specific things you are interested in, and it will give you a refined list of what's available in your community. So that's another great resource for caregivers at home. This next slide, ALZ Connected, is also another really terrific resource, particularly to help both caregivers and also people in early stages of dementia to connect with people going through the same thing that you are going through. And it's a blog sort of thing where you can go online, whether you're a caregiver, a person living with the disease, a concerned family member, or individuals who have lost someone related to dementia. And Again, you can click on topics that you're interested in. You can see what's been posted most lately. You can read those, and this is all free to participate in. You don't need to sign in to view it, but if you want to post a chat, you will be asked to create a profile. And this gives you an opportunity to learn directly from other caregivers and engage in conversations with people in a safe way at whatever time of day is convenient for you. So again, I really recommend that you check this out, www.alzconnected.org. And this next slide, this is actually one of my favorite resources. I just think that this is amazing. This is the Alzheimer's Navigator. And there are so many things to consider when you are dealing with a loved one with dementia, or if you have your own concerns. And this helps guide caregivers to answer questions by creating a personalized action plan and linking you to information and support and local resources. So again, like for instance, if you were to click on medical resources, you will receive, or connecting with your doctor, for the first thing you'll see is maybe a 3-question questionnaire. And I believe this one says, do you feel that you have good communication with your doctor? Yes or no. When you leave your doctor's appointment, do you feel like you've understood everything they've said? Yes or no. And I can't remember right now what the third one is, but whatever you click on and then you submit it, it will give you some step-by-step instructions about how to prepare for a visit with your physician, how to make sure that when you leave that appointment, you have really had all of your answers, all of your questions answered, and that sort of thing. Similarly, if you go to legal planning, it will ask you if you're interested in healthcare powers of attorney, setting up wills and trusts, financial powers of attorney, those sorts of things. And it will, again, ask you several specific questions, and then it will link you, well, it will provide you with really specific guidance. So this is really an outstanding resource. You know, I've checked all of these things out. I've done them for myself, for my own information, to help people in the support groups that I facilitate, and just to make sure that I know what's out there for people who are looking for support. And again, whether you're caring for someone in a time of a pandemic or not, these resources are really remarkable and they're free to use. So please do take advantage of them. So now that's the last of the formal presentation. And if people have questions, please go ahead and submit them. I'd be happy to try to answer whatever I can. And thank you for this opportunity to let me share the resources of the Alzheimer's Association with all of you.
Thank you so much, Francie, again, for your wealth of knowledge. The resources you provide are certainly absolutely of great help for us. They are in the chat function, folks. If you weren't able to get those website addresses, they're there for you. And also the reminder about making sure we take care of ourselves when we're providing care for others. Such an important task that we often overlook. So thanks for those reminders, Francie. And so questions and answers are open now. If you have any questions, feel free to use the Q&A box located at the bottom of your Zoom screen, or you can put them in the chat bar as well.
Stephen, maybe I'll take a moment also to mention that support groups are something that are now, of course, offered virtually. There are some people who do it by phone, but most of them now are available by Zoom. And again, you don't have to go to a scheduled local support group. For instance, the one that I co-facilitate happens to be 2 Wednesday evenings a month. But if someone calls the helpline on Monday, even if they live here in Santa Cruz and they say, I really need to join a support group today, they'll connect you with one in another location that happens to be going on Mondays. And you can see each other on screen. The people, we have new people joining all the time, in addition to people who are kind of veterans of the support groups. And I see people being welcomed in such warm ways by people who've had more experience, who are really happy to share their experience with people who are just starting on the journey. So that's something that both helps people stay connected. It provides them information. It gives them an outlet, and they are with people who really understand what they're going through, where other friends and family may not.
Thank you, Francie.
Hmm.
Becky Peters asks, my family's in South Carolina. Is there a way for them to see this excellent comprehensive presentation? Because it was indeed comprehensive.
Oh, well, thank you very much, Becky Peters. This whole presentation is being recorded, and you can watch it. You'll get information about how that can happen, but also going to alz.org, you will find that this presentation, COVID-19 and Caregivers, is available at different times in various communities, and your family members could log on to that given by a different facilitator. I hope that answers your question.
Great, thank you, Francie. I don't see any other questions popping up here, but folks, if you do, after the fact, have some questions that do come up, please feel free to submit them while this webinar is running, or you can go to our website, go to info@lifespan.com, or lifespancare.com. I think you can submit a question there and we can get the responses back to you.
Certainly, and of course you can call the 800 number helpline from the Alzheimer's Association, and you can get all the information you need about caring for a loved one and yourself. There's so much information there. It's really an amazing resource. Again, thank you for listening.
Thank you so much again, Francie, for being present with us today. Your knowledge is just incredible, and it's so vast. I always appreciate being able to listen in on what you have to share about Alzheimer's and dementia.
Thank you.
Yeah, thank you. All right, so folks, we are moving a little early today, so I would be happy to present Lynn Knutson and Sally Bookman. As Executive Director of Next Stage Productions, Lynn Knutson continues to inspire seniors through education, community engagement, entertainment, and wellness initiatives. Today, Lynn will share about Next Stage Productions and then introduce Sally Bookman, who will then present Ferris Wheel, a virtual Zoom performance. Thank you both for being with us today. Lynn, the floor is yours.
I love the floor. Thank you, Stephen. I'm always so impressed with Francie and her presentation. Thank you, Francie. I'm going to go back and listen to it and take notes. Well, hello, I'm Lynn, and Next Stage Productions. What we are doing is we are changing attitudes toward aging. Let's face it, as my father-in-law said, old age ain't for sissies, no place for sissies. Thank you, Betty. I've enjoyed you in the movies. It's true, it's tough as you age. But I positively love the title of this webinar, Aging Well with Resilience. Well, we've been showing resilience with the pandemic, that's for sure. Let me tell you a little bit about Next Stage, a 501c3 charitable organization, and it addresses the next stage of your life. We are aging well, as Sally will attest when she speaks. We are resilient because we use creative and expressive arts. In 2012, I'll give you a little background, I was given a personal development grant by the Arts Council of Santa Cruz County to attend a summer camp at Stagebridge Senior Theater in Oakland, California. Well, the week was full of wonderful classes in performing arts. And being a retired musical performer, I was in heaven, learning, witnessing the accomplishments of my peers who were 50 through almost 90. I was in heaven, yes. And using music and movement and storytelling, they did a great job. Well, Bingo! I couldn't, it was there. There it was, what my next calling in life was going to be. So, back to Santa Cruz, with the encouragement of my colleagues and the support of the Arts Council, we replicated the Stage Bridge program. And in 2014, we spun off as Next Stage Productions. The goal of Next Stage: to educate, engage, and enrich the lives of active adults 50 plus and their communities through creative arts experiences and health and wellness initiatives. So, in education, Next Stage conducts training in theater arts, storytelling, voice, dance, whatever, and has conducted a summer camp for seniors at Cabrillo College for the past 7 years. Then the Next Stage players, I think we have a cast of 14 right now, travels to healthcare facilities, bringing entertainment all through the years and especially during the holidays. Well, there's been a pause on that, as you know. We can't visit the healthcare facilities right now. And we have seen tremendous growth in our health and wellness programs, like Time Slips. And that's a unique storytelling program for the cognitively impaired. And drumming for PWPs, that's people living with Parkinson's disease. A big hit. We just started the voice class pilot project 3 weeks ago. You know, the science is there. Everyone knows that creative and expressive arts will enhance the lives of individuals. We are a team of teachers, artists, and community leaders dedicated to providing affordable programs to make the aging journey more comfortable and more fun. But with the onslaught of COVID-19, everything had to stop. But not for long. We're resilient. We demonstrated our resilience and our capacity to recover quickly from the doldrums of the pandemic by providing some pivotal changes in the way that we present our program. Yes, we went viral. In closing, let me say what we offered for the past 8 years has proven to be so very important. We are fighting isolation in the elderly. We're lifting spirits and healing through the arts. We are offering experiences that entertain and teach. We are engaging the community in opportunities for joy and self-expression. And we are really making a difference in people's lives. I love my work. I just can't tell you how encouraging it is. And when I go to sleep at night, I am so proud and so happy. My life is a joy because of the arts. So let me tell you that next you're going to see a dynamic woman by the name of Sally Bookman. She is an artist, she is an actress, she is a director, she is a creator, and she's one of our key volunteers. And she's created the Next Stage reading theater, and she'll tell you all about it and all about her interventions during COVID-19. So take it away, Sally.
Well, thank you, Lynn. My goodness, that's quite an introduction. Francie, I really like the fact that you talked so much about the importance of social connectedness, because that's what Next Stage has been all about, as Lynn said. You know, it's we're bringing together seniors 50. I mean, who's a senior at 55 and 60, right? I don't know when we become seniors, but I'm 77. I don't think of myself as a senior yet, you know. But anyway, we bring people who are entering that next stage of life together through musical performance and singing and classes that Lynn talked about. But with the COVID virus, it's prevented us from continuing our classes and from performing these live musical reviews at the senior living facilities. So something had to be done to keep all of our performers and participants engaged in some way. And so Readers Theatre was developed as a means to keep people engaged and connected, and at the same time to produce works that would entertain those sheltering at home. Reading scripts, weekly rehearsals over a period of months, planning costumes have kept our seniors active and given them a purpose and an achievable goal. Our first series was rather ambitious. This was when we started back in March, April. We produced a total of 7 short plays of about 10 minutes in length that involved 15 seniors. Using Zoom was new for all of us, and we learned a lot during the course of putting together these 7 shows. Not only did we learn Zoom techniques, but our actors self-taught themselves on improving their acting skills by watching their recorded performances. We were in a much stronger position when we moved on to Series 2. Series 2 consists of 3 Zoom plays of approximately 20 minutes each, and you'll get to see one of those today. And then a longer 44-minute radio play. We're doing Alfred Hitchcock's 39 Steps. These plays involve a total of 19 actors, the majority of whom were not in the first series. So this second series has taken the Zoom process further with the use of backdrops, music, props, costuming, and action. So as I said, today you're going to see one called The Ferris Wheel, with our Next Stage Players artistic director, Hannah Eckstein, in the leading role. We're very lucky to have Hannah here in our community. She's a professional actress who's performed for years in Los Angeles and on TV shows and in films. And she just brings a high level of quality to our shows that help us all aspire to do better. In the 6 months since COVID put us all back in our homes, we have involved a total of 34 actors over the age of 60 in our plays. And in one play that is just being released now this week, one of the 2 players is 93 years of age, and you would never believe it, 93. And we have, I should mention also, while I'm thinking about it, in our musical reviews, we have women who are in their late 80s and one woman in her 90s. So we are inspiring other elders to see themselves in these roles and to realize that life hasn't ended. There's a whole new adventure out there. So we feel that if others see actors like themselves performing, then they might feel a certain level of lift and might even want to pick up the phone and say, I'd like to be a part of that. And when we had our virtual auditions, we had more people auditioning than we had parts for. And already I'm getting calls from performers from Series 1 who said, when can I be in a play again? So we know we're doing something right. Finally, I must mention our murder mystery, Bullets on Broadway, that was produced and directed by Owen Lynn Newton, and Steve Matzy was in it too. And this video is now available on YouTube for public viewing. And let me see. So I think about 20 participants in that one. So if you add that to the other 34, we've involved getting on for 60 different seniors just in the last 6 months during COVID. We don't plan to stop. Wait for Series 3. So in summary, I would say that in the last 6 months, Readers Theatre and Murder Mystery involved over 50, almost 60 seniors in theatrical performance. Readers Theatre has given our participants a purpose, an achievable goal with a satisfactory outcome. Readers Theatre has challenged our actors to become familiar with scripts, to learn their character, and to learn to act in front of a computer screen, alone in their homes with no other actor on stage for support. That's a challenge in and of itself. Readers Theatre has given our senior participants confidence in themselves to stretch to do something they might never have done before. We have a lot of first timers. Readers Theatre's actors have all had to learn about Zoom, how to use the technology and how to utilize it to their benefit. This has helped towards alleviating a fear of computers, a fear not uncommon among the senior population. Our actors end up with a product, a copy of the recording that they can proudly share with family and friends. COVID or not, Readers Theatre is here to stay. And I look forward to your suggestions, your support, and welcome comments. And now please enjoy a visit to the Santa Cruz Boardwalk and Ferris wheel. Thank you, Steve. And thank you, James. If you could now show the film.
Excuse me. I hope I'm not crowding you.
Oh, no.
I would have taken another seat, but the line is too long to let anyone ride by themselves. They force you to be a couple whether you want to or not. Not that I mind. I mean, it's a pleasure. Are you comfortable?
Oh, yes, just fine. Woo! We're off.
Are you all right?
I'm fine.
Are you sure?
Couldn't be better.
But you're not looking.
No, heights. I'm afraid of heights.
And you ride a Ferris wheel?
Oh, just once a year on my birthday.
Oh, happy birthday.
Oh, thank you.
You're welcome. Your knuckles are turning white. Are you sure this is good for your circulation?
Well, what doesn't kill me makes me stronger type of thing.
So, you do this in lieu of a birthday party with cake and ice cream?
Oh, no, I have that too. When I get through, like a reward.
But you go through this first.
Oh, well, my daddy started it and I keep it up.
Was he frightened of heights?
Oh, no, he just believed you should do something that frightens you at least once a year. Builds character, strengthens moral fiber. You ought to try it sometime.
I am riding.
No, you gotta do something you're frightened of. This doesn't count if you're not frightened of heights. Oh, I had this cousin once who tried to pretend like she was frightened of small places until she got locked into the attic during a thunderstorm. Lightning struck the house and it burned it to the ground.
Oh, and now she's frightened of fire?
Oh, no, sir, she's dead. You can't go messing with things like that.
Oh, truth is stranger than fiction.
Oh, don't you know? Once I had this teacher named Mrs. Thumb who was missing 2 fingers. She used to say, to paint, all that was needed were 10 good fingers, and she held up 8.
Oh, are you all right?
Oh, I'm fine. You're not from around here.
No, passing through. I saw the Ferris wheel and I drove on over. That's my little red car down there.
I'll take your word for it. It's funny running into a man like yourself, riding a Ferris wheel alone.
I used to do this as a kid, but you get older.
Oh, nonsense. You never get too old. My mama always said you're only as old as you feel. Of course, some days I feel like 100. Oh my God, what happened?
Looks like we stopped.
Why?
We seem to be stuck.
Oh, don't do that.
Do what?
Don't move. You're rocking the car. Oh, please don't rock the car.
I'm sorry. They're probably just making an adjustment. We'll be moving any minute.
Yes, yes. We should be rolling any minute now. Minute.
Would you care for a cigarette? Calm your nerves?
Me? I don't smoke. Do you?
Not if you don't want me to.
Oh no, it doesn't bother me. No. You know, when I was younger, I saw this demonstration with an invisible man. They hung this little sack from his windpipe, and they said it was an exact duplicate of a human lung tissue. Then they put this lit cigarette into the plastic mouth. Well, he watched the smoke slowly trickle down into his lung sac. All of a sudden it started popping and bubbling and disintegrating right in front of our eyes. And it was as if nothing but a brown, dripping glob hanging off of that clear plastic windpipe. They said that's what happened to a layer of your lung every time you take a puff. So I don't care to smoke myself, but if you want to, you go right ahead.
I was thinking of giving it up. Now is as good a time as any, right? Do something you're frightened of, sure.
Oh,
Why
but-
not?
Yeah, once you do, it's best not to take it back. Oh, remember my poor dead cousin.
I don't need a cigarette.
Oh, good.
It must be mechanical.
Mechanical. We could be up here for days.
No.
It is possible.
Well, anything is possible.
Oh, God!
Why don't you open your eyes?
I'm frightened of heights.
Oh, just lean back and look up,
Lean back. Look up.
like in a field on your back. Nothing to be scared of.
Lean back. Looking up. Lean back. Oh, looking up. Yes, yes. Oh, God, it's going to rain. Oh, this thing will rust solid and we'll be stuck up here forever.
It's not going to rain. My knee locks up when it rains, and it's fine. See?
Don't move.
I'm sorry.
Oh, so much for my luck. Oh, I should have checked my horoscope.
We're going to be all right. I'm going to be all right. This isn't so bad.
Bad. I knew today was going to be bad when I saw the cream in my coffee curdled up like a relief map of the Himalayas.
It's easy.
You know, like the kind of maps we made back in high school out of flour and salt water. Oh, of course, my mother would never let me cook. Oh,
I should have quit a long time ago. How long has it been? Oh, you wouldn't happen to have any gum? Juicy fruit? Double mint?
gum. No, my grandmother never allowed it.
Oh, neither would mine.
She thought it was tacky, bad for your teeth,
It's a waste of money.
socially incorrect.
She grew up during the Depression. Always kept her money in a black leather purse under her arm.
My family has always been socially correct, even at the most incorrect political moments.
When she died, that was the first time I'd ever seen her without that purse.
My cousin made her debut during the Vietnamese War.
I thought, without that purse, she wasn't going anyplace.
My sister was a Nixonette during the Watergate Convention.
No, not heaven,
We got our first color TV on the day Kennedy was shot.
and not hell.
Spent the rest of the week watching his funeral
They say her house is haunted.
in black and white
I know what she's looking for.
on a color TV.
That damn purse.
So I doubt that I have any gum, but hey, you are welcome to look. here.
No, I can wait. Oh, just 5 minutes. I'm already starving. I'm going to blow up like a blimp.
Oh, what are you doing?
Nothing.
You're moving.
I'm not moving.
You're twitching.
Twitching?
Yeah, your leg. It's going like a house on fire. Are you nervous?
Or is this some kind of a warning sign before you break into a full, uncontrollable fit?
I'm not breaking into a fit.
A nervous twitch. Oh, wouldn't you know it?
I'm not twitching. Look, don't look. See? Steady as... Oh, God.
Oh, God. Oh, God, what if they make me climb out on a ladder? Well, I can't climb out on a ladder. I'm gonna be sick.
Oh, take a deep breath. It's mind over matter. Just breathe. Breathe. Better?
Better.
It's all about willpower. Visualization. See a stream. A peaceful, quiet, winding stream. Draw it into your mouth. Taste it. Feel it going down, hitting you here. You wouldn't happen to have a Tic Tac, Lifesaver, a cracker?
Well, I wish you'd quit mentioning food. It's like talking about going to the bathroom in a car during riding down the highway.
Oh, I hadn't thought about the bathroom.
Just promise me one thing. Promise me you won't eat me.
Eat you?
It happens. I've read about it. Snowbound in the Andes, shipwrecked on a deserted island. Two people stranded together, one eats the other. Well, instead of falling in love, you have to worry about being dinner.
I'm not that hungry.
Well, of course, I could stand to lose a pound or two, but I never lose it when it counts. It drops out of my face and it makes me look like a cadaver with hips.
I feel fat. Do I look fat? I'm putting on weight and I'm just sitting here.
Oh, nonsense, you're thin.
I used to be thin.
I used to be thin. In high school, I was so thin that when I wore pantyhose, I pinned them to my bra. Oh, well, that kept my pantyhose up and held my bra down.
Well, you blossomed nicely.
Oh, thank you.
A regular beauty pageant contestant.
Oh, I was once. Oh, but I didn't win.
Prettiest girl doesn't always win.
Well, of course not. If looks were all that counted, anybody could win.
I'll bet you won Miss Congeniality.
Me? Oh, no. Oh, but she was incredible. She had a way of making friends, getting coffee, greeting and grinning and greeting, always saying you're prettier than she was. And let me tell you, this is one surefire way to make friends at any beauty pageant contest. Why, the night of the final, she came fully equipped. Vaseline for your teeth and double-step tape for your bathing suit. Needles, threads, a walking medicine cabinet for headaches and cramps. Everything from dental floss to Dr. Scholl's. I voted for her. You know, you can't let that much talent go unrewarded.
And she was your cousin?
Oh, would that she were. We would have been proud to have her in our family tree.
Oh, I'd have thought anybody as chatty as you would have won Miss Congeniality.
Oh, that's just my breeding. My mother always used to say it was our social obligation to be entertaining.
Well, you don't have to feel any obligation on my account.
Oh, no, you're very easy to talk to. I can talk to you all day long.
Ouch, darn.
You're going to bite those nails down to the nubbins if you're not careful.
It's just a hangnail.
I had this roommate in school once who got gangrene from a infected hangnail. Nearly had to have her finger cut off.
Oh. You said that cousin of yours, she broke this pack and she died, right?
Deader than a doornail. They say that poor little body was charred beyond recognition.
Stop. I'll give you $100 if you don't say another word.
I can never take money from a stranger. My mother always told me never take money from
Is it
men.
hot up here?
Never.
Do you feel hot? I feel hot.
No.
Are you sure? I mean, you haven't stopped talking since we sat down. I'm sorry, it's my fault. It's only been 5 minutes. They say when you die, your life flashes before you in 5 minutes. I never believed that was possible before now.
I'm sorry. I'm boring you.
You're not boring me. It's just, I've been smoking ever since I was 12. My folks gave me $1 for the collection plate at church, and I fish out enough change for a pack. God got the bulk of it, but he's getting even now.
No, you're right. I do talk too much, especially when I'm nervous or scared. You know, sometimes I get so wound up, I can feel myself floating up over my body, and I just want to slap myself silly and say, shut up, shut up, shut up, shut up. Oh, like now. Oh, I'm so sorry. Oh,
It's okay.
no. You see, my greatest flaw is I just want people to like me. I'm the only person I know who thought Sally Field's acceptance speech at the Academy Awards, "You like me, you really like me," had real depth. I understood what she meant. But sometimes what we do has the exact opposite results.
I like you.
Well, how can you even tell? Well, you're so busy twitching and biting and swaying, rocking.
I'm listening, and I forget about smoking when I'm listening to you.
You're teasing.
No, I do like you. And I don't even know your name.
Oh, my name is Dorian. You can call me Dory.
Pleased to meet you, Dory. I'm John.
Oh. Oh my God. Oh my God.
Just look up.
Oh,
Look up. Better?
yes. Oh, I'm sorry about the smoking.
No, I was planning on giving it up sometime. Sooner or later. Maybe. It's a nasty habit. It's just a matter of keeping your distance from those little white, perfectly round 3 1/4 inch cigarettes. Oh, God.
Oh, I bet your wife will be so happy.
I'm not married.
No,
You?
me? Oh, no. But you, I assume.
Nope. Divorced. Traveling salesman. Only she couldn't take the traveling, so she moved on.
Oh, I'm sorry.
Yeah, well, you get used to being alone. You get over it. You adjust.
Isn't that the truth? I don't even mind eating by myself anymore. Not as long as I have something to read. You know, like a newspaper or a magazine, or those little bitty sugar packets they set on the table, the ones with the history of each state written on the back. You can learn a lot eating alone. You know, state flower, state bird, state motto, state. Why did you do that for?
I don't know. I thought if I kissed you, maybe you'd stop talking for a minute.
Oh. Oh. I wasn't even talking.
No, I just needed to do something with my lips.
Oh. So you didn't mean anything personal by it. It was just sort of a reflex action.
No, it wasn't just a reflex. I enjoyed it.
You did? Oh, did I tell you I have an aunt who lives in Dublin, Georgia? Well, she's related to Kim Basinger. Well, did you ever see the movie The Natural? Well, she's in it. Kim, not my aunt, and she. And then they started filming and everything. Your lips lips itching for another cigarette,
No, well, partially.
but not wholly?
I just wanted to see if I enjoyed it as much the second time as I did the first.
And did you? Oh, what was that?
Looks like we're moving.
Oh, God! Oh, oh.
It won't be long now. They're letting us off one by one.
Oh, you don't think we'll get to go around again?
No.
Oh, they'll probably close it all for good. Oh,
Huh? Well, this is us. It's
Yes.
been a pleasure.
yes, well, I guess you'd better get going and have that cigarette. I wouldn't want you to get into any trouble kissing every girl, but just to say that you could make it through the day without smoking. Look at me. I'm still talking again, and here we are, safe on the ground. I don't know what's the matter with me. Well, I guess I better get going.
Are you coming back next year?
Well, it is a tradition. And, well, you know my family. We're keen on tradition.
Wow, I hope that touched everybody's hearts the way it touched mine. That's just amazing. And I want to thank you again, Lynn and Sally, and Next Stage Productions for helping us to all remember that we can remain engaged and creative as we age. And as the two characters in the show saw, maybe get a little love there too. Thank you again, Lynn and Sally.
Pleasure.
Lynn, so there's a question from one of our attendees asking, will there be more Bullets on Broadway? They enjoyed that performance very much.
Get the name and address of that person who just asked the question.
They answered it anonymously, so I don't know if I can.
Okie doke. Well,
yes,
yes, that was the first one, Bullets on Broadway. But the truth is that we joined the organization called Broadway Murder Mysteries. And as a member of that group, we're being offered additional themes. Maybe the next one will be Murder Under the Big Top. But Sally has something in mind. And Sally, did you want to mention your plan for the next murder mystery?
Oh my goodness. Well, I haven't even procured the rights to it yet, but Clue, based on the popular board game, is being performed by about 19 different companies around the country in 2021. I actually saw a list of the different companies and I thought, well, why don't we be 22 next stage? So I'm thinking about that. But the radio play has just taken up so much of my energies for 6 months. And now it's in the hands of the videographer. And I'm going to need a little bit of a break before we move on. But already I've, as I said, people calling saying, when's the next one? You know, sign me up. So there'll be auditions coming up. And if anyone's interested, we'd love having new people. So just send me an email, sally@sallybookman.com. We'll see if we can't find you a part.
Thank you,
And
Sal.
of course, you can always go to our website, which is nextstagesantacruz.org for information and announcements of auditions. And thank you so much, Stephen. This has been so much fun.
Great, thank you. I'm so glad that you were here. And folks, on a personal note, being able to participate in Bullets on Broadway with Lynn and Sally and just a great cast of folks was a lot of fun. So again, I encourage you, anybody that's here, to go to nextstagesantacruz.org, take a look at their potentials, and be a part of a growing and amazing community of older adults who are still creative, still remaining engaged. So again, thank you, Sally, and thank you, Lynn, for providing us this great ending day entertainment. Really appreciate it.
Bye-bye.
Bye now. So this brings us to our close of our first day. I thank everybody for being present with us today. We're running a little early, so you'll get about 27 minutes back to your day. It is our hope here at Lifespan that you will consider joining us again tomorrow. We have another great round of presenters on tap. Kathy Kress will be with Clay Kempf, Vanessa Silverstein of Hospice of Santa Cruz County, Dr. Arthur Dover, who will talk about the intersection of COVID and flu season, to name a few. So please come back tomorrow, same time, 9 o'clock. And I also want to thank all of the presenters that were with us today. Such great information, great opportunities for us to hear how we can support our older adult community to remain mindful of taking care of ourselves while we're taking care of others. So thanks again to all of our presenters. So to close our day, I would now like to welcome Lifespan's Chief Operating Officer, Ashley Min, to provide some closing remarks.
Thank you, Stephen. Today was just fantastic. I really enjoyed getting to see all the work put together. It felt very piecemealed all these weeks. So seeing it today and together was just a really a breath of fresh air and of excitement. So thank you. Good afternoon, everybody, and congratulations, and thank you for making it to the end of day one. Your attendance to the Lifespan team really means everything, and I say that from the bottom of my heart. We're very grateful for all of you and very grateful for all the presenters today and tomorrow. I'm Ashley Min. As Stephen mentioned, I'm the Chief Operating Officer. I have been with Lifespan, this incredible agency, 6 of its 37 years of existence. I've had hands down the most valuable mentors who are not only, were not only bosses to me, but friends and family to me. So it's just been a real pleasure all of these years, and it just keeps getting better, believe it or not, even within a pandemic and in a a world that is full of unrest and tragedy. Life continues to get better, and this profession continues to mean more and more to us, and hopefully to you and the clients and everybody we serve in the community. Annually, we do host events and open houses, but we've never done a virtual event of this nature. So thank you for your support today. We are going to meet at the end and fix a few kinks that hopefully only we just noticed, and we'll be back tomorrow, and it'll be better than ever. And I would love to hear from you guys, our audience, if there's anything that in the future you would like to have discussions around, or speakers you'd like to see in the arena of aging and aging well. We're passionate about it, and we want to be able to continue bringing events like this to the community, and more than just in California, but all over. So if there's anything that pops to your mind in terms of something that you would like to discuss or hear, please let us know. Drop a note in the chat box, or feel free to email us. And again, thank you, and thanks Stephen and all the presenters for a wonderful morning. We'll see you tomorrow.
Thank you, Ashley, so much. And remember, everybody, it's all about living your best life and aging with resilience. So come back tomorrow at 9 o'clock to join us. have a cup of coffee, start with some seated stretches, and we'll look forward to seeing you then. Thank you again for your attendance and presence with us today. Have a great rest of the day, everybody.